Hi, everyone. I think there's just one other person at the moment watching this webinar. But thank you for coming along. And my name is Dr. Joy Vyas, and I am the program director for the postgraduate taught dermatology programs. So today I'm just going to take you through what we do, or rather take you through all our programs and just talk to you in detail about them. Since you are here at the moment, is there a particular program that you actually want to go through? It would be great if you could type your name in, even if it's just a pseudonym, that would be great. Nope. Okay, fine. Right. Okay. So I'm just going to go through all the programs that we have for dermatology at Cardiff University. And what I'd like you to do is, if you have any questions, please feel free to type in the Q&A box, and I'll try to answer them as we go along. But if I can't, then we'll do it at the end of the program. So just to start off with, we have a lot of programs. So we have the face-to-face MSc in clinical dermatology, the diploma in practical dermatology, the MSc in practical dermatology, and then we have our short courses or continuing professional development courses, which are an introduction to dermoscopy and an introduction to hair and nail dermoscopy. So if I just move on to the next slide here. So with clinical dermatology, this is our face-to-face program. And this is for people who have an undergraduate degree in clinical medicine. So could be an MBBS or MBBCH or equivalent. And it has to be awarded by a recognized institution. We do have some English language requirements, and all applicants must demonstrate the standard level of academic English, which is available on our university website pages. Now, one important factor here is that in order to attend the program, there must be evidence of completion of 1 year's full-time equivalent post qualification in general medicine. Now, this could be part of internship or not. However, that depends upon your institution. If before your institution you get a provisional degree from your university, or rather from your medical council, then that internship will be counted as 1 year's post qualification, postgraduate experience. However, if your degree, or rather your internship, is part of your degree, after which you will get the degree and your registration with your medical council, then you must have an additional 1 year's full-time general medical experience in order to apply for this program. So where do we have the MSc? So the MSc is a 1 year full-time course which is delivered face-to-face at the Welsh Institute of Dermatology, which is at the moment situated at the University Hospital of Wales in Cardiff. So what do we do in the MSc? So the MSc, it offers a very structured education in dermatology. Here, not only do we have clinical instruction, but we have a large emphasis also on the theoretical or the basic sciences part of dermatology, because what we would like to show you is the inner workings of dermatology, or rather why certain diseases present in a certain way. And in order to know that, you need to know the theory, you need to know the pathogenesis. Knowing this will help you understand why certain diseases present in a certain way, and will also help, therefore, then to know what medications should you give for that particular condition. So we have a lot of lectures on the theory and the practical aspects of dermatology, and you will also be observing clinicians in clinics where you might have the opportunity to clerk patients. And our USP is that the MSc in clinical dermatology is taught by world-renowned experts. So if you have a look at our faculty, we have faculty from abroad. We have Dr. Mark Tang from Singapore. We have Prof. Gunther Hofbauer from Switzerland. We also have a lot of national and international experts from the UK, like Prof. McGrath, just to name a few. And these names will be very familiar. If you read the Rook's textbook, you will see a lot of names in the textbook that actually teach on our program. Now, in addition to just the lectures, we also have practical workshops where we have a practical surgery suturing day. We have Doppler assessments. We'll have a dermoscopy workshop, and we also have regular meetings for continuing professional for continuing a professional education, which then is you can attend online as well. And as I said before, in order to supplement your understanding of the theory and the knowledge of dermatological conditions, you will be sitting in clinics where you can clerk patients. There will be opportunities for day treatment unit where you'll be allocated there and you can see patients and the other treatments that they're receiving, where you can clerk patients there. And we have a lot of different modes of learning. So we have one-to-one lectures, we have workshops, there'll be some virtual clinics. So it's very blended, including like tutorials, small groups, workshops. Now, with the structure, it is a full-time course. And although it takes place over 1 year, it consists of two stages. You have the taught stage and the dissertations phase. And the thought state lasts for approximately 8 months, and it consists of six 20 credit modules. So altogether, that would amount to 120 credits. And the teaching sessions are from Monday to Friday during normal office hours. There are occasional Saturdays that you might have to attend, but these are not very many. Um, a practical skill module runs throughout the 8 months, and this is supported by significant patient interaction and day treatment unit placements, and along with virtual clinics. You will have mainly the clinics will be in University Hospital of Wales. Occasionally, we may send you to clinics in surrounding areas for certain special teaching sessions. In order to get the diploma, you may leave after successful completion of all the six modules or acquiring 120 credits. Or you can leave after successful completion of three modules, wherein you would get a certificate for successful completion of 60 credits. But most of our students go on then to the taught phase, to the dissertation phase, which is a few months from, say, June to September. And this is a brief glance at our six modules that we have, which is the Introduction to Dermatology, Disorders Presenting in the Skin and Mucous Membranes, Environment and the Skin, Practical Skills, Cutaneous Manifestations, and Skin Cancer and Surgical Interventions. So once you have finished all six credits and successfully pass them, you can then go on to the dissertation phase. However, if you wish to exit at the certification phase, which you can do so after having successfully completed 60 credits. It doesn't matter which 60 credits you complete, but you could leave having just completed 60 credits, in which case you will get a certificate in dermatology. Now, in order to help you learn, we do have virtual textbooks and online software that you will have access to once you are enrolled in the programs. So what happens in the dissertation phase? So the dissertation phase lasts for approximately about 4 months, and therefore your thought phase and dissertation phase together is approximately a year. And it'll include a dissertation phase of 60 credits. So what is in the dissertation phase? Here, what you will be doing is you will be asked to write on a particular topic and complete a dissertation based on literature review for for the 4 months. And the literature review would be a 20,000 word dissertation. And you will have help in deciding what topic to choose, and you will be allocated a supervisor who will help you, or rather support you in writing the dissertation. However, the dissertation phase is can sometimes be a little bit strange because it's not a postgraduate taught stage wherein you come into class all the time. For largely, you will be doing work yourself, whether it's, in the library, or whether it is, doing it just coming into the institution and doing it at the university library. I must add, though, that especially if you are a if you are an overseas student, according to the current visa regulations, whilst doing the dissertation phase, you must be based in Cardiff, and you're not allowed to go back home unless there are extenuating circumstances, but this changes from time to time. So for your dissertation topics, I've just put up a few topics here. They could, your dissertation topics could be on a variety of different areas here. And that would be by, we can talk about topics if you have enrolled on the program and when it's time for the dissertation phase. Before you do start off on the dissertation, we have a 2-week block or a 1-week block, depending upon how the classes are arranged, wherein we take you through the skills of how to write a dissertation. And it's not just in this dissertation block that we expect you to suddenly learn how to evaluate articles. So within the thought phase as well, there will be sessions on academic writing. We will show you how to use research banks and how to use um, software such as EndNote. There will be regular journal clubs where you will be asked to present so that you get into the frame or idea of how to critically analyze journal articles. So although the dissertation phase will begin in June, you will have the skills, you will be developing the skills on how to write all throughout your thought phase as well, in the form of assessments and journal club presentations. Okay, so that's all about, or rather, that in a nutshell is everything about our MSc in clinical dermatology, which is a face-to-face program. And if either do you have any questions here at the moment? Okay, if not, then what I'll do is I will go on to our diploma in practical dermatology. So diploma in practical dermatology, it is a distance learning program, and it's conducted entirely online. So you are able to balance the studies with your professional and personal commitments. And this is aimed at those who wish to develop a special interest in dermatology. Um, as, and this we have a scaffolding here. So we have modules that are written by experts, but alongside that, we have dedicated tutorial support. This is delivered entirely online via the university's virtual learning platform. There are discussion forums where you can discuss the material with each other. There's tutor support as well, and all the exams are online. So this lasts for either 1 year for a full-time student, or 2 academic years for a part-time student. Once again, this consists of 620 credit modules. So in order to have a diploma in the UK, you have to have 120 credits. So these for these 620 credit modules, you will have about one per term on the part-time PG dip over 2 years. So that would be about 3 modules per year. So students who obtain a maximum of 60 credits at level 7 will be eligible for the exit award of the postgraduate certificate. So once again, just like in the taught programs, should you be successful at 60 credits and want to leave at that point in time, you're able to do so with a postgraduate certificate in practical dermatology. So these are the examples of the module titles that we do have. Obviously, there are a lot of subtopics within each of these modules. Sorry. And then graduates who have a merit or distinction. So 60% would be a merit. So graduates from the diploma in practical dermatology who do have a merit or distinction can then go on to apply for the MSc in practical dermatology on a competitive basis. So for the MSc in practical dermatology is once again a 1 year program. However, this is part-time. This is considered a part-time 1 year program with 60 credits. And it is for practicing general practitioners or other doctors who are practicing dermatology regularly and who have obtained a postgraduate diploma in practical dermatology. It is a part-time distance learning course. So once again, this is also fully online. Here you would be expected to once again write a 20,000 word dissertation. However, this dissertation is different to that of the postgraduate taught face-to-face MSc program. Here, you'll be asked to write about 5 cases that you see in your dermatology practice with a theme. And so, for instance, it could just be the use of, say, isotretinoin for acne, or it could be, laser treatment for, let's say, in different conditions in dermatology. So there is some kind of a theme that we can help you write about. This is not a literature review based dissertation, but it's a case based dissertation supported by a brief literature review. So what are the entry requirements for this particular one? So at the moment, you have to be a Cardiff University graduate with either a distinction or a merit, or you may have completed the program from the Queen Mary University, London. That may be subject to change in the future. However, you must have completed the diploma from either institution not more than 5 years prior to the start of the MSc. You will require a personal statement that states that you're involved in the care of patients with skin problems. And this is because the dissertation is a case-based dissertation. So you would also have to have evidence of continuing professional registration with a relevant medical body. So it consists of one dissertation stage lasting for 12 months. And the reason it's 12 months is because it's part-time. And we've already talked about the requirements that you have to have completed the diploma in practical dermatology, either from Cardiff University or Queen Mary University, London. And once again, we will have a 10-week block initially of online study, which will help you develop your research skills. And then you can go on to complete the dissertation. So we will be helping you along the way as well, helping you develop the skills required for writing a dissertation. So at the end of this, when you finish, you will be a proud alumnus of the Russell Group University, which is highly regarded in the UK and world over. So any questions regarding the DPD and the MSc in practical dermatology? Okay. Fine. So I'm going to go on to our CPD courses. These are our continuing professional development courses in dermatology. These are again completely online. So we have 2 continuing practical dermatology courses. So one is an introduction to dermoscopy. So this runs entirely online, run over 12 weeks with online assessment. This is entirely flexible. You can access the course when you want to during the 12 weeks. You will gain insights into the latest techniques from international experts. So how do we run this program? So we have modules that you will read, but each module, apart from the first introductory week module, is for 2 weeks. Now, when you are in this 2 week module, not only do you have the content to read, which along with photographs, which have been written by renowned experts in dermoscopy like Prof. Iris Zalaudek, Professor Jeppy Argenziano, just to name a few. Now, during these 2 weeks, you will also have a tutor who's very well versed in the field of dermoscopy, and they will be putting up cases for you. So they'll have photographs and they'll ask you for your descriptions and for your diagnosis. And this is all asynchronous. So the tutor will put up a case, and then you have the time to write, to figure out and write the answers to the case at your own time. And this we feel is what sets it separate from other dermoscopy cases, because not only do we give you the material, but we give you additional extra real world cases to help you develop your skills in dermoscopy. In addition to this, there will also be two live interactive lectures by world-renowned experts in dermatoscopy, such as Prof. Zalaudek, and you will be working and learning with peers. This is a very cool international course. So you have people from all over the world looking up at, and you can interact with them and have group discussions with your peers and with the tutor-led experts. So these are just a few of some of the feedback that we've had from our past students. And we've already gone through this. Now, who is it for, though? It's for doctors. So the dermoscopy course is for doctors and for specialist nurses working in skin and healthcare professionals working actively in the skin cancer clinics. You have to work in a cancer clinic or have to be seeing skin lesions or skin cancers for this course to be helpful to you. Um, it's structured and you can work at it at your own pace. However, you have to have completed one topic in order to unlock the next topic. So what are you going to learn with this? You're going to develop competency using a dermatoscope to differentiate melanocytic from non-melanocytic skin lesions, malignant from non-malignant lesions, assist in the early diagnosis for melanoma, assist in management decisions relating to pigmented lesions, mainly just knowing, is it benign? Is it not benign? Do we need to take it out? Or do we not need to do a biopsy? So this is just an example of the timetable for the dermoscopy. So we have like six topics. Like I said, the first topic is for 1 week, and this is then followed by each topic lasting 2 weeks, and then you have the examination week and a reset week if required. The other online course that we have is an introduction to hair and nail dermoscopy, and this is quite relevant to people mainly, and it can really help people in tropical countries where they would see a lot of conditions on hair and nails. However, um, it's always useful to be able to detect fungal infections and other nail conditions using dermoscopy. So this is specifically for doctors and who are involved in the case of dermatology patients, but can also be for specialist nurses and other healthcare professionals actively working in skin clinics. It's once again structured. That you do have those interactive live lectures once again here in this program. And Here, the aim is to develop competency in using a dermatoscope to understand the normal trichoscopic features of the scalp and hair and the normal onychoscopic features of the nails to differentiate between types of cicatricial and non-cicatricial alopecia. This can help, and you can avoid biopsies here, assist in the diagnosis of other scalp conditions, especially and hair and scalp condition and nail conditions in patients of skin of color, and differentiate between traumatic and infective and inflammatory nail disorders. Once again, this is the example. This is actually a 16-week course as opposed to the 12-week course for skin lesions. And once again, you will have the topic material that has been written by international experts, Professor Bianca Peracini and Dr. Stars. So we have very, very uh, internationally known experts who have written your material, and uh, you will also once again have experts in trichoscopy and onychoscopy, just like in the introduction to dermoscopy, where the tutors will put up cases and you can then in your own time respond to these cases, and have interaction with your peers and the tutors. And that's all, folks. Thank you. Do we have any questions? I can wait for a couple of minutes to see if there are any questions. Sorry, I'm unable to see any questions if there are any. Oh, sorry, here I can see some question. How many hours are required for full-time study on the postgraduate diploma course? Um, I would say it would be around, I guess it just depends upon how long you would take to read and assimilate the material. But I would say maybe around 5 to 10 hours is required per week. Any other questions? Okay, so I've just had an update from the course lead for the diploma in practical dermatology, and she has said that for part-time students, it would be 10 hours per week and 20 hours per week for full-time students on the diploma in practical dermatology. Okay, so if there are no other questions, I will then end the event. And thank you very much for. Okay, sorry, there's another question. Beyond the structured curriculum, what challenges do students typically face during the program? I'm not really sure what you mean by what challenges the students face. But in terms of the face-to-face program, if you mean in terms of being in Cardiff, I think what a lot of people sometimes find when they first come out here is maybe just adjusting to the cold, but people do get used to that. Another thing is food. I think food is it can be a little bit of a challenge initially because we have people from different cultures coming in, and sometimes that takes a little bit of getting used to. But eventually, you eventually you find your way here, and you get used to a lot of things. Yeah, another thing is the daylight hours. So in the winter, you can find it getting dark really quickly, but in summer, the glorious sunshine lasts for a very, very long time. So I'm not sure, is that what you meant, or do you have, or would you like, or to ask another question regarding the challenges? I think English can sometimes be a problem as well, but uh, which is why we do have the uh, minimum English speaking score before you get on to the program. And in terms of written assessments, then, we do have sometimes where students will send their work to somebody to correct for English before they actually submit it. But I'm not sure if there are any other, I can't think of any other challenges actually at the moment. Any other questions? That was actually quite a good question. Okay, I see there's another one there. Um, about the exam component of the diploma course, can this be taken flexibly at any time? So, in terms of this, for all of our programs, we have a time limit by which you can take the exam. So, for instance, there might be a particular week by which time you have to submit. By which time you have to submit an assessment. So this varies because some of them are things like case reviews. Sometimes it could just be online questions. So as long as you do it within the time frame that is allocated, you can do it at any time within that time frame. Any other questions? Now, sometimes with regards to the exams, people cannot life comes in the way. There might be some extenuating circumstances. So we do understand that. And if you cannot submit an assessment before the time frame, then what we would advise you to do is to submit an extenuating circumstances prior to the deadline, in which case there could be the possibility of an extension for the assessment. You're welcome. Thank you. Bye. So I'll just wait a couple of minutes before any other questions because I can't see if anybody's typing or not. So I'm not sure if anybody is, but I'll wait another 5 minutes. And if there are no questions, then I will end this seminar. And thank you very much for attending. So Cardiff is a great place to come if you want to come in person. And there is a lot of support available for all our online programs. So I promise you, you will not regret. Um, in fact, you will really enjoy being part of the Cardiff University community. Okay, great. So fine. If once again, thank you so much for attending. And as there are no questions, I will now end this webinar. And hopefully we will see you in Cardiff or encounter you online on one of our programs. Thank you very much. Thank you.